I've had a great question here. What should I do in advance of my botulinum toxin or Botox appointment? There are a couple of housekeeping things I would say. Try and arrive on time so that you're not stressed. You're going to have an injection medical treatment and you want to just feel calm and prepared. So arrive with plenty of time to spare. Try and have your breakfast that day so that you're not feeling a bit faint. Ideally, don't have treatments within a day or two of the start of your period. Or do, but just know that you might be a little more sensitive to the needles, or mention it to your practitioner and they can help reduce the discomfort with various measures. I think always then have a think about what are your concerns, what areas would you like to have treated, whether you want a really subtle result or whether you want a stronger result. And think back to your previous treatments and decide really what result you would like to achieve. If you're new to it, I would say don't worry. It's really a common treatment that we do every single day. We try and make it as comfortable as possible, and we're usually having these treatments ourselves, so we're conscious of keeping it as easy as possible. First time people often say to me, is that it? You know, are we done? They just can't believe how really quick and painless it is. So definitely tell your practitioner if you're somebody who's prone to fainting, because it happens all of us now and then. Occasionally somebody will say, I don't feel great. And if we are forearmed, then we're better able to deal with it. If you have think about the couple of days before your treatment, try not to have a lot of wine or alcohol beforehand. You're going to be more prone to bruising. Don't stop any prescription medications, and that's especially important for things like blood thinners, for aspirin, for example, for people who are taking it preventatively to help prevent a cardiovascular event or a stroke. So don't stop those prescription medications. And if you're in any doubt, just ring your practitioner and find out. Don't come if you have a cold sore or a skin infection on your face, because we're not going to be able to treat you. We really want a nice clean base to put the treatment in on. And we don't want to trigger an infection in the eye where you could theoretically spread infection if you've got an active cold sore. If you are looking for some skincare advice, bring your products with you or take photos of them. Write down any questions you have, because as we all know, when we go into a medical appointment, everything just goes out of our mind and it's hard to remember questions until we get back out again. So if there are questions you particularly want to have answered, write them down. And also, if you're looking at a combination treatment, you want to add something on like a skin booster like Profhilo, or you want an LED light session, or you're thinking about dermal fillers, ring your practitioner and ask them in advance, because they'll have scheduled a certain amount of time for you. And what you don't want is to go for your regular treatment and then have something rushed added on at the end. You want your practitioner and yourself to be as prepared as possible for your treatments. Your aftercare then after your botulinum toxin or Botox treatments. A lot of the instructions that have been given out are really not relevant. The main thing is think of it like a liquid medicine. So you're going to have tiny injections, and we don't want that medicine to spread from precise muscles and doses where we're injecting here. We don't want it spreading into the lid. So it's generally good not to be rubbing your face or putting on makeup for a couple of hours afterwards. And if you can come makeup free, all the better, but don't worry if you can't, we can clean the skin beforehand. So the first thing I would say is afterwards, no running around or jumping or jogging for a couple of hours. But people come into me and after their treatment, they almost feel they can't move their head around. So you can move your head, you can turn normally, you can go shopping, you can go have a coffee, you can go back to work, but just don't be rubbing those areas. And because you've got needle marks, we recommend no makeup for a couple of hours, no pets licking your face. Say you had botulinum toxin and you went for a run afterwards. Your blood pressure is going to increase, the blood flow is going to increase, and we don't want that toxin moving from where we've placed it, and we don't want your blood pressure rising and giving rise to a bruise. So generally just take it easy for a couple of hours. Most people can, you can exercise a couple of hours afterwards. You can sleep any side you sleep on. You can have a glass of wine that night. You could fly the same day. So some of the aftercare instructions that people have been given really aren't relevant. And I think some of them relate back to the early days of botulinum toxin, where a much bigger dilution was used. So more volume was being put in. More chance of bruising, more chance of swelling. Whereas now we really concentrate that dose down like a concentrated Ribena or orange squash. We're putting in really precise doses, and we don't want it to spread, and we want it to be as comfortable as possible. As always, if you have any side effects that you think are related to your treatment, get in touch with your practitioner, and they should give you an urgent out of hours number so that if you had a particular concern, they're available to give you that advice. And with any toxin treatment, especially if you're new to it, it's better to go gently. Have a free optional review 2 to 3 weeks later, depending on your practitioner, and they can always add in some more, but they can't take it away. In Ireland, botulinum toxin is a prescription-only medicine, and so you have to see a doctor or dentist, and they have to personally administer it. But in other areas, you need a consultation with a medical practitioner, and then they can delegate that administration to somebody else. Ask to see the product. It's being injected into your face. Discuss the medicine that you're getting, discuss any concerns that you have. You'll be asked to sign a consent form, and that's standard practice. And then don't come if you think you might be pregnant or breastfeeding. If somebody comes in to me and I ask if they might be pregnant and they start counting days on fingers, I'm getting really nervous and I'm not likely to go ahead and treat them. There have been a couple of studies, particularly in the US, where women either unknowingly have had Botox and been early on in a pregnancy, or have knowingly had it to treat serious migraine during pregnancy. The outcome studies are fine and didn't show any adverse effects with the babies. But if somebody comes in and says they're pregnant or breastfeeding, I would absolutely not treat them. Better to be safe. And if somebody's combining their Botox treatment and trying to coordinate it around an IVF appointment, the last thing I want to do is cause any unease or any concern that there might be a connection with them being pregnant. So I think bear all those things in mind. It makes then your chance of a wasted trip less, and it will ensure you get the best result. So have a good think about what you want to achieve. If you are looking for very subtle results, bear in mind your treatment is not going to work for a couple of days, and then your peak result will be at 2 weeks. If you have a big family event, bear in mind you could get a bruise. So it's planning all of those things. And then if you're in any doubt, just ring up ahead of your appointment and say, listen, I'm flying to the Canaries next week. Is that okay? And so we really want you to be as well informed as possible. So I hope that's helpful. Feel free to get in touch with any queries. Take care. Bye.